Minister mentioned there may be some additional restrictions now on people on our side of the border in that border zone. Have aged care facilities actually been told not to have visitors, or there's just increased awareness in that area?
So this is the usual process we undertake, and so we undertake an assessment of where we think there might be community transmission and what is our settings for aged care. Now this is a balancing act because this is the aged care residents' homes. It's important that aged care residents are stimulated, that they have a good quality of life. There are disbenefits from them being not engaged. So we have to balance these risks, and that's why it's never a perfect, we can't guarantee that we'll never see COVID enter into aged care facilities. But obviously it's prudent that we identify those for residents in that border that may have gone into Shepparton. We alert them to make sure that they haven't been any of those high-risk venues at Shepparton. And at this point we're also just saying don't go and visit relatives just for the next couple of days. We had a teleconference with Victoria Health this morning, and we know that they're doing lots of testing, and the Shepparton community has come out in force to get tested, and it means that really quite rapidly we will have an understanding about whether there's been any unknown chains of transmission. So because this transmission event happened back towards the end of September, what we're concerned about is that these people that were infected from this could have been and infected others that are unknown and then set up chains. But we might rapidly get an assurance that if the majority of people with symptoms in Shepparton have been tested quite quickly and all of those contacts and casual contacts have been identified, then we have comfort that there really isn't a risk that there's an explosive outbreak that would pose greater risk to the border communities. And then we can ease those restrictions. So to some extent this response to aged care or our visitor list is as what we would do in New South Wales. I think if any of you visited health facilities, you will have been asked whether you've been to any of our at-risk venues. And this is just the standard precautions we're going to have going forward.
Minister, there's some more relief by the sound of it this morning with this number, but still, in terms of restrictions, we've got some big events coming up soon.
We do.
Race, finals of the sport. So what's your message there then to those organisations and those crowds?
I think the message to each of the large events that are coming up, to the organisers particularly, but also to those who are attending, is actually play by the rules. Make sure that you have all of the COVID safety requirements in place and that everybody who is attending actually complies with it. We do know, as a result of, as Dr. Chant has said, the fact that we have 3 clusters, 2 of those have unknown elements to them at this stage, and that is broadly a red flag for us, that we could have other people out and about in our community who have the virus, and they could be attending one of those functions that we're all hoping to get to in our more open New South Wales. But take care. Treat everybody at those functions as if they have COVID, because we could actually see people getting the virus, obviously. But that's the balancing act. In New South Wales, I mean, we've had Victorians up here for professional reasons with health and so on, and the point they've made is how great it is to be in New South Wales, where New South Wales is open. It's open and we're enjoying it, but we have to enjoy it sensibly. So treat everybody else as if they've got COVID, and that might be the wisest thing for each and every one of us at the moment. Can I just say this too, that obviously Dr. Chan and I have both stressed the testing issue. Yesterday we both, and the Premier, all talked about the fact that the government, New South Wales government, is keen, very keen, to advance the lessening of restrictions. But yesterday there were concerns. We still have concerns today, but we're closely monitoring those with public health to see if we can try and relax some of those restrictions. We're very keen to, but we also have to balance it, and that's been what we've done right from the start. So this afternoon I will be working with Dr. Chant and our public health team, and then tomorrow morning we'll be certainly reviewing it yet again on any information that comes up today to look to when we can next move to try and help business, but help the community have an even more relaxed life here in New South Wales.